thank you, Dean, Senator, Representative. You kind of really set the stage. That last slide is remarkable when you see the impact of what they're doing. I know we have some dentists in the room. Does anything look familiar there? So that's the face you get when you're running behind on hygiene exams and you throw your hygienist. That's Irene Newman. So that's the first dental hygienist ever. Her and her husband, or cousin, I'm sorry, started a dental hygiene school in 1913, the Fawn School of Dental Hygiene. And I was when I was doing the research on this, and I was looking through all these pictures of dental hygiene schools through the decades, and they all kind of looked the same. You have all these young women training, usually one guy kind of in the background looking a little bit bored, kind of overseeing them. And I just kept looking through, and then I looked at a current picture of a graduating hygiene class. And you have to ask yourself, how much has really changed in over 100 years? Not really a whole lot. And then when you look, now I know there's some different statistics, but I did it by how many hygiene hours would be needed to take care of our population in Pennsylvania. We would need 4 times more hygienists than we currently have now. I'm going to put some context into what we're doing at Central Penn College, just looking at the hygiene situation. But the problem is it's getting worse, it's not getting better. We're not graduating enough, but we're also losing hygienists out of the field. There's articles that are talking about, is dental hygiene a 10-year career? How many people in this room, dentists or hygienists, people in dentistry, will go somewhere and somebody said, I used to be a dental hygienist? Happens all the time. I've never met somebody say, I used to be a dentist. Dentistry is a career. Dental hygiene has unfortunately become a job. I think the expert on this is Dr. Linda Straw-Bruce, who just did her doctoral dissertation on the factors that are pushing dental hygienists out. And it's a lot, it's many. In Pennsylvania, the problem is specifically difficult because hygienists in neighboring states can make more money. They also have a much larger expanded scope of practice. So when some of these dental compacts start to expand and they have mobility to different states, we're going to see more and more hygienists leaving. The problem is we are not allowing for growth within clinical hygiene practice. So this picture here, it's not actually the patient, but this is what I did Monday in practice as a dentist. I mean, we are digitally capturing faces, skeletal, dentition. We're layering. I mean, I'm excited going to work every day because every day it's something new with the technology. I don't think dental hygienists are experiencing the same thing. And when they do get to expand their scope of practice, it's like a fight. It's a horrible, horrible fight to try to get that changes in place. And we talk a lot about how some areas are underrepresented, don't have the appropriate care. I think it's, yes, some of these rural programs are going to help tremendously, but you have to have enough hygienists if you want to fill all the slots. And for our group, which is based in this area, our dental group, we recruit from rural areas because guess what? That's who wants to come. We can't get somebody from Philadelphia to come to Harrisburg, but we can get somebody from Tamaqua to come to Harrisburg. So we need enough people to fill all these spots. We won't do that, Senator, I promise. We'll stay out of Tamaqua. So we need more hygiene education opportunities. But the other thing that's happening is we're weeding out folks that want to work with their hands and their brains for folks that primarily just want to work with their brains. When you think about how hard it is to get into hygiene school, it's almost harder to get into to hygiene school than it is to get into dental school. So you're taking so many prerequisites. You have to have a lot of academic ability, and you have to be intellectually geared. So we're getting these very, very, very smart individuals, and we're asking them to do a repetitive job. So when you see some of the hygienists promoting the field of hygiene, they're talking all about being ambassadors of wellness and education and doing all these things. What they don't talk a lot about is their love of mechanically debriding teeth, right? The problem is cleaning teeth, that's what's reimbursed. That's what the patient wants. That's what the patient expects. And it's something we have to do. It's where prevention starts. So some of these efforts that we do, they're all amazing. We need to keep doing all these things, but we have to think past just subsidizing and really getting to a point where we have an economically viable model. So the FQHCs are amazing. There was a wonderful clinic that opened in Mechanicsburg not too long ago. They needed to hire 3 hygienists. So 2 of the 3 hygienists came from our practices. So what did I do? I put an ad out. I had to raise the rate, the wage to get people to apply to the ad. We got applicants. I hired from Dr. Jones down the street, who then had to put an ad out, who hired the 2 hygienists from the FQHC that left my practice. So it's a shell game. And every time a hygienist is moving around, they're understanding the supply and demand, the supply and demand nature, and wages are going up. So what then happens? I have to drop participation with insurance companies. So unless we get the underlying workforce issue fixed, none of those other programs are going to be viable. We're just subsidizing more expensive things. So the best business model wins. Dentistry has been really good for a lot of providers. I mean, dentists do pretty well. We take off on Friday and go to the country club and golf. But it hasn't done well for patients. There's a lot of patients that are left out the door. So if we want to improve access to care, we need economically sound solutions. And I think we need to modernize the workforce. Now, we are going to have a surplus of dentists. There are new dental schools opening up, and the rate of retirement is now slowing down. Those dentists, though, do need the support. There have been bottlenecks in the hygiene programs, which we are aware of. The problem is, we are graduating dentists. The average debt of a dentist is over $300,000. The student debt for a hygienist is a lot less. I just interviewed a dentist that had $750,000 in debt. She's looking for a new position because she's working at a clinic doing, guess what? Hygiene. So we're making these really expensive things, dentists with student debt, without the auxiliary help that they need. So if you were to sum up the problem, we have bored and burnt out hygienists, dentists coming out that aren't going to be making enough money to pay their loans, nobody to remove plaque and calculus from teeth, restoration over prevention, and then a bunch of dentists that want to do Botox. So that's like our associate dentists, they're taking Botox courses. So what are we doing here? I think the coalition has said we have a collapse of the dental health system. I love this quote. It says the greatest danger in times of turbulence isn't the turbulence, it's acting with yesterday's logic. Linda, in her dissertation paper, talked about how all the different stakeholders aren't really coming together. I love that. I see that little person pulling that boulder up as Helen Hawkey, that's the Coalition of Oral Health, doing a great job. But we have to come together here. You know, the dentists and the hygienists, we all have these different ideas of what to do. We're protecting our profession. And then poor, Senator Argyle doesn't know which way to turn because he's getting conflicting information. So we have to find a way to kind of come together. This is where Central Penn College comes in. We really kind of took a look at, what does the industry need rather than what does CODA say we should do? I mean, we still got to do what CODA says we should do, right? Ann Hoffman, our director. But, how can we kind of look at things a little bit differently? This slide talks about for us, it's $2 million to get the hygiene program started. Now, this occurred to me the other day. I work in a dental implant center. I do dental implant cases. My patients alone in one dental implant center spent $2 million out of pocket last year. So for the amount of money patients in one dental implant center, seeing one doctor in that center, we could start a program. And the slide that the dean showed is right spot on. I looked at this, it's $3.5 billion in today's dollars worth of wages that those graduates would have over 30 years. We look at all the different kinds of pathways, how people can not only get in, but where they end up. And Central Penn College has certificates, associates, bachelors, and masters. So a lot of those hygienists that do want to go on to other things, they can get bachelor's and master's degrees in management. But here's what I think we need to think about a little bit differently, and it's going to have to start with an educational review of what the system currently looks like. So the advent of EFTAs was phenomenal in Pennsylvania dentistry. I am much more productive. I work with 3 EFTAs when I'm in the clinic. Dental assistants are staying in dentistry. It's a career now because they can get a license and be an EFTA. Hygienists aren't going to want to make less money. We're not going backwards. They don't deserve to make less money. But it's not going to be viable to keep doing what we're doing. I think we need to look at something like a licensed hygiene assistant that could do some of the mechanical debridement of teeth, that could do some of those things, and open up a role for an advanced dental hygiene practitioner, much larger scope of practice, but also has the ability to supervise. A dental hygienist should not be working out of one room. They should be supervising people just like a dental. Now, all the dentists are going to cringe because the idea of, not in this room, but in some spaces, the idea of expanding scope of practice is scary. I think the key is that this is a grand bargain where those licensed dental hygienists or licensed dental hygiene assistants need to work under the supervision of both a hygienist and a dentist. Some states are moving away from the hygiene model. The dentists don't know, dentists don't know how to do dental hygiene. So I like the idea of that team supervision. So this is where Central Penn College comes into play. We're looking at new ways, innovative ways to educate folks. They're very motivated and nimble. They have housing, unlike a lot of community colleges where we can recruit students and serve students from all over the state. Very innovative moving forward. So I thank you for the opportunity. We do have scholarships available for dental assisting and EFTA programs that are currently running, and scholarships available for hygienists that want to pursue bachelor's degrees and master's degrees. And also there's a policy brief that we've put together on some of the modernization of the workforce stuff. So thank you.